Hello everybody and welcome to the Thursday edition of Video Clips. I started something last week that I think this will be the last installment in this series for a while, but a letter to the patient, a letter to the person who's considering options or maybe not considering options. And so I always have people asking me, what can I say to somebody who's getting traditional treatment for heart disease, diabetes, Crohn's disease, whatever, to convince them to take a look at something else. And so this is a piece that you might turn over to somebody or give to somebody who you'd like to have listen and maybe isn't paying attention. So I'm just going to read it to you. It's from me. Dear patient, you're reading this letter because someone who cares about you very much hopes that you might decide to investigate other and potentially more effective methods of addressing your health issues. The intent of this letter is not to talk you into or out of any particular course of action, but rather to interest you in asking more questions and learning more. My company, Wellness Forum Health, assists people in evaluating the risks and benefits of tests, drugs, procedures, diets, supplements, and any and all services offered by healthcare professionals so they can make informed decisions about care. One of the major shortcomings of today's medical environment is that discussions about medical services usually involve only benefits, which are typically exaggerated. Risks are seldom discussed and often minimized even when they're significant. Consequently, one of the most common statements I've heard in my office all these years is, if I had known then what I know now, I never would have, and you can fill in the blank, had this test, taken this drug, agreed to this procedure. Additionally, alternatives to drugs and procedures are rarely mentioned in traditional medical settings. We think that people should know as much as possible before proceeding with medical care, rather than researching options for resolving problems resulting from medical care after things go wrong. So essentially what I'm advising people to do is to use the same scrutiny when purchasing medical services that most people use when they're purchasing houses and cars and hiring financial planners. Following are some key points to consider in reference to your own current plan of treatment. The first one is the definition of effective is important when evaluating treatment. Efficacy in medicine is usually defined as improvement in markers for disease like cholesterol or fasting glucose, or changes in symptoms like pain. It's important to realize that these are what we call surrogate markers, meaning they're laboratory measurements or symptoms that can be reflective of the activity or progression of disease, but they are not actually the disease. No one dies of high cholesterol, for example, but people do die of coronary artery disease, and high cholesterol is a marker for coronary artery disease. Today's medicine focuses on changing surrogate markers, and success, and I would put air quotes around that, is achieved when cholesterol is lowered, pain is reduced, and tumors are shrinking. The problem is that these changes in symptoms and markers do not always mean that health is being improved or that outcomes will be better. For example, statins reduce plasma cholesterol levels significantly and rapidly in most cases, but they only reduce the risk of cardiac events and deaths by less than 2%. NSAIDs, non-steroidal anti-inflammatory drugs, are effective for reducing pain, but they don't cure arthritis. And most of us have unfortunately known a cancer patient who responded to treatment with shrinking tumors but died from cancer anyway. With today's medicine, it's possible to feel better, for your lab results to improve, while you actually get worse. One very public example of the failure of Western medicine to effectively treat disease is Tim Russert, who hosted a popular Sunday morning news show. Russert was a wealthy man who had excellent insurance coverage, and he could afford to visit some of the best doctors in New York City. At the time of his fatal heart attack at age 58, he was taking drugs for his high cholesterol, drugs for his hypertension, drugs for his pre-diabetic condition, and he took an aspirin every day. His biomarkers were excellent, and 6 weeks before his heart attack, he saw one of the best internists in New York City who sent him home and told him he was fine. Well, he obviously wasn't fine. He died of a heart attack 6 weeks later. Russert's biomarkers may have been normal or fine, but his health certainly was not. Former President Bill Clinton's story has a happier ending, but not because of traditional medical advice. The best doctors in the country take care of, and I would put air quotes around that best, take care of our president, and that's the way it should be. These best doctors supervised Clinton as he ate his way into worsening heart disease and then prescribed medications for his markers of heart disease like high cholesterol. While medicated, his coronary artery disease continued to progress until he had a bypass surgery, but this didn't solve the problem. The arteries clogged up again, and that's why he had an angioplasty. This time, however, Clinton got a little smarter. He decided to take matters into his own hands and figure out what was going on. So he started reading books like the China Study in Prevent and Reverse Heart Disease, and learned that coronary artery disease was caused by diet and in many cases it could be stopped or reversed by a changed diet. He subsequently changed his diet, lost 24 pounds, and stopped the progression of his disease. Now here's the important point, the most important point perhaps. The strategies that saved Clinton's life were not recommended by his medical doctors. In fact, they did not know about these strategies. Clinton's cardiologist said at the time of his angioplasty that his cardiovascular disease was not a result of his lifestyle or diet. That's a quote. And then went on to say that Clinton's numbers were all good, but the cardiovascular disease is a chronic condition. He said, quote, "We don't have a cure for this condition, but we have excellent treatments." That's patently false. This very prominent and important, best cardiologist simply doesn't know. So another question to ask yourself, are you getting better or just feeling better? There is a big difference. There are many perceived benefits of medication and procedures. They're highly recommended by most doctors. Insurance covers at least part of the cost. And they usually have an almost immediate impact on symptoms and pain and that sort of thing. So for example, a person with inflammatory bowel disease, such as Crohn's or colitis, will take drugs and often see symptoms improve, sometimes pretty rapidly. But here is what the Crohn's and Colitis Foundation says on their website about drug treatment for inflammatory bowel disease. Number one, medications do not cure the disease, but they can result in remission or lack of symptoms. Remissions can last for months or years. Changes in medications are often required because they stop working. Patients do well on medications for a while and then they stop responding. Medications don't work at all for some patients, and surgery to remove parts of the GI tract may be needed. About 45% of colitis patients and 75% of Crohn's patients will eventually require surgery. In other words, IBD patients often feel better, but they don't get better when medicated. On the other hand, IBD, like coronary artery disease, responds well to dietary intervention. But in all likelihood, a traditional doctor won't tell you this. Remember, the former President of the United States, Bill Clinton, had to find out on his own how to improve his health. Now, I want to be clear. Western medicine is very effective in some situations, particularly for trauma and emergency. However, Western medicine is not as effective when used to treat chronic and degenerative conditions such as type 2 diabetes, coronary artery disease, and inflammatory bowel disease. This is why people seldom recover from disease. Instead, they're taught how to manage their conditions, and it's also why people often end up taking multiple drugs. Now ask yourself, what do you really want? In my experience, many patients do not know how to express what they really want from healthcare. I can tell you this, nobody's ever joined Wellness Farm Health with the objective of having the best blood tests in the neighborhood so they have bragging rights with their friends and family. But often their discussions about health have not involved much beyond that, just getting good blood work. People join here because they want to regain their health. They want to live longer. They want to live better. Biomarkers shouldn't be ignored, but all methods of changing them don't lead to health. Bill Clinton was able to change his cholesterol readings with drugs, but that didn't lead to health. Diet changed his cholesterol and led to health. Big difference. You owe it to yourself to investigate. What if the treatments you're receiving aren't helping and are even worsening your health? What if there are better options available? Wouldn't it be better to know? I'm sure Tim Russert's family wish he had known that his health was so precarious and that better options were available, such as changing his diet, which could have saved his life. And I'll end with this. It never hurts to check things out. Healthcare decisions are quite personal, and your decisions should be respected by everyone, including the person who gave you this letter. But you might have more peace of mind knowing that scientific evidence supports your treatment plan, not just faith in your doctors, and that you can actually get better, not just feel better. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you Tuesday with more news.